work me through this one here.
Okay, so which of the following is the most likely mechanism contributing to the airway obstruction in this patient? 60-year-old female with a history of smoking presents to the clinic with complaints of productive cough, shortness of breath, wheezing, experienced these symptoms for past 4 months and has had similar episodes for past 3 years. PFT reveals decreased FEV1, FVC ratio, and increased residual volume. Again, which was the following is likely mechanism contributing to the airway obstruction in this patient? Okay, so she is an older female smoker. That's going to be the big contributing factor there. And then so she's leading to shortness of breath, wheezing, and then we see that she has a decreased ratio there. So whenever it's like smoking, I think of a few things. That's not what this question is asking, but just further on. Let me just stick to this. I don't want to get too far out. So I see the smoking, and then I see the decreased ratio. So this is going to be a obstructive
Okay.
pulmonary pathology that we're dealing with here, and so we're going to be dealing with like restrictions. So increase in what total lung capacity, increase in residual, decrease in all the expiratory stuff. And so which of the following is likely mechanism contribute? So it's going to be destruction of the alveoli is what I'm thinking. Alveolar collapse, bronchial smooth muscle constriction, decreased surfactant production, increased mucosal secretion, interstitial fibrosis. I'm thinking collapse.
Final answer.
Smooth constriction. Yeah, let's go with that.
Okay, so let's talk about this. So this is kind of, you had the right idea. This question is not the greatest worded question. It's a little bit of a trick question. So I'll talk to you kind of what you did great here, and then we'll kind of break down kind of how they're testing you here. So you have a 60-year-old female, history of smoking, productive cough, shortness of breath, wheezing. Anytime you have a smoker with these symptoms, you got to be thinking of a couple things, right? Sorry, excuse me. You got to be thinking one, COPD for the wheezing, shortness of breath, because smoking is usually going to give you a COPD. And then also on top of that, a productive cough. Anytime you see a productive cough, you're always thinking, is there a possibility of chronic bronchitis? Okay, so you're kind of thinking both things here. Okay, 4 months, so you know it's a chronic issue. Similar episodes for the past 3 years. Decrease FEV1 FVC ratio, increase residual volume. So this decrease in FEV1 and FVC, that's going to be obstructive, exactly like you said, right? Increased residual volume, which is also part of a obstructive disease. So you're thinking COPD, and then which of the following is the most likely mechanism contribute to the airway obstruction of the patient? So first, the diagnosis, you're thinking of COPD or chronic obstructive pulmonary disease, right? So you're looking through this and seeing if anything fits. Alveolar collapse, meaning that the alveoli are actually collapsing on itself. You're thinking more of like a atelectasis here. So that's not really a COPD, right? Bronchial smooth muscle constriction. This is more of an asthma, right? Mechanism asthma. Decreased surfactant production. This is like when you're born, you know, like NRDS or ARDS, right? Kind of ordeal. So that's more of a kind of a restrictive pattern ordeal, right? And then interstitial fibrosis is restrictive. So I like that you picked alveolar collapse because you're thinking about the alveolar destruction in COPD, but actually alveolar collapse is going to be opposite here, where it kind of, instead of ballooning up, which happens in COPD because you know you're air trapping, this actually collapses the wall. So you know that this can't be kind of the match for COPD. This is more of atelectasis. So increased mucus secretion. So they're saying that what is most likely contributing to the airway obstruction. So this is kind of a tricky question because overall she has COPD, but on top of that, she probably also has something like what, chronic bronchitis on top of COPD. So which fits with their symptoms. So the best answer that will fit there is increased mucus production, which is why she has chronic cough or productive cough. I mean, meaning there's a lot of sputum. So
Right.
it's a little bit of a trick question, if that makes sense.
Yeah.
Yeah, so like I said, you know, alveolar collapse really for atelectasis, not for chronic bronchitis or COPD. Bronchial smooth muscle constriction, that's asthma. Decreased surfactant, right? Usually, right, acute ARDS or NRDS, right? Interstitial fibrosis, right? That's going to be mainly associated with interstitial lung disease, idiopathic pulmonary fibrosis. and then that's a restrictive lung disease, not obstructive. Okay.
Yeah. Okay.
So I like how you work through it from top to bottom. Just kind of like this is a very tricky question, right? Because you yourself are looking for alveolar destruction. So they put alveolar in there, but collapse is atelectasis, not COPD. So very close.